The technology that saved the world from a pandemic wasn't created for that pandemic. Its original target was something far more ancient and personal: cancer. We're talking about messenger RNA, or mRNA. While we all now know it for COVID-19 vaccines, its true origin story is now coming full circle, promising to reprogram our own immune systems into the most precise cancer-fighting machines imaginable. This isn't science fiction. This is the new frontier of oncology, and it's happening right now. Instead of the brute force approach of chemotherapy or radiation, which carpet bomb the body and cause immense collateral damage, mRNA cancer vaccines are like a surgical strike. The concept is revolutionary. Don't attack the cancer directly. Instead, teach your body's immune system to recognize the cancer as a foreign invader and eliminate it. It's a fundamental shift from poisoning a disease to empowering our own natural defenses. So how do you give the immune system a crash course in oncology? It all starts with a sophisticated training manual delivered in the form of a synthetic strand of mRNA. This mRNA is essentially a recipe. It provides the genetic blueprint for our cells to temporarily produce specific proteins called antigens. The key is that these antigens are unique markers found on the surface of tumor cells, like a flag identifying the enemy. Researchers hunt for two main types of these flags. The first are called tumor-associated antigens, or TAAs. These are proteins that are found on some normal, healthy cells, but are massively overproduced on cancer cells. Targeting them is effective, but it carries a small risk of the immune system getting confused and attacking healthy tissue. It's like telling your army to look for soldiers wearing a very common type of camouflage. But the second type is the Holy Grail: tumor-specific neoantigens. These proteins are completely unique. They only exist because of the specific genetic mutations that caused a healthy cell to turn cancerous in the first place. Because these neoantigens are found exclusively on the tumor, they are the perfect, unambiguous target. Targeting them is like giving your immune system the enemy's exact coordinates, minimizing any chance of friendly fire. Once scientists identify the best target antigens for a specific cancer, they design and synthesize the corresponding mRNA sequence. But this mRNA is incredibly fragile. On its own, it would be shredded by enzymes in our body within seconds. To protect it, it's wrapped in a tiny protective bubble of fat molecules. This delivery vehicle is called a lipid nanoparticle, or LNP. You can think of it as a microscopic armored car. It shields the precious mRNA cargo on its journey through the bloodstream, and, just as importantly, helps it merge with and enter our cells. After the vaccine is injected, these lipid nanoparticles are gobbled up by the sentinels of our immune system, specialized cells called dendritic cells. Once inside, the mRNA is released from its fatty bubble. The cell's own machinery then reads the mRNA blueprint and starts churning out the tumor antigens. The dendritic cell then does something remarkable. It takes these enemy flags, these antigens, and displays them on its own surface. It effectively holds them up and shouts, "Hey, immune system, this is what the bad guy looks like. If you see this, attack." This presentation is a critical education process for the real soldiers of the immune system, the T cells. The dendritic cells activate and prime these T cells, transforming them from passive patrollers into a highly targeted army of cancer killers. These newly trained T cells then circulate throughout the body, on a mission to seek and destroy any cell they find that bears that specific antigen. This is a crucial advantage. While vaccines for viruses often focus on creating antibodies, fighting solid tumors requires a powerful T cell response, and that's exactly what mRNA vaccines are brilliant at inducing. To make the attack even more robust, a single vaccine can even be designed to carry the mRNA code for multiple antigens at once, making it much harder for crafty cancer cells to mutate and escape detection. This is powerful stuff, but where mRNA technology truly enters the realm of futuristic medicine is with personalization. Cancer isn't one disease, it's thousands of different diseases. Your lung cancer is genetically different from someone else's lung cancer. Every tumor has a unique genetic fingerprint of mutations, which has always been a massive hurdle for creating one-size-fits-all treatments. mRNA technology doesn't just sidestep this problem, it embraces it. The process of creating a personalized cancer vaccine is a symphony of modern science. First, a small sample of a patient's tumor is biopsied. That tissue is rushed to a lab where its DNA and RNA are sequenced, creating a complete genetic map of that specific cancer. Powerful computer algorithms, often using artificial intelligence, then sift through this mountain of data. They identify the unique mutations and predict which of the resulting neoantigens are most likely to trigger the strongest possible immune response from that individual patient. Based on this analysis, a completely bespoke mRNA vaccine is manufactured from scratch. It's designed to encode for dozens of these patient-specific neoantigens, creating a weapon tailored exclusively for one person's disease. And here's the most stunning part. This entire process, from taking the biopsy to having a custom vaccine ready for injection, can take as little as 6 weeks. In the world of cancer, where time is everything, that speed is a game changer. It's the ultimate form of precision medicine, a guided missile for your cancer, leaving your healthy cells completely untouched. This isn't just theory. The results from clinical trials are starting to pour in, and they are incredibly exciting. The most impressive results so far have come from combining these vaccines with another type of immunotherapy, called a checkpoint inhibitor. Think of it this way. Your immune system has natural brakes or checkpoints to stop it from going overboard and attacking your own body. Cancers are clever, and they learn to press on these brakes to hide from the immune system. Checkpoint inhibitor drugs essentially release those brakes. So when you combine the two therapies, the mRNA vaccine acts as the GPS, pointing the T cells directly at the tumor, while the checkpoint inhibitor takes the foot off the brake, unleashing the full, unhindered force of the attack. The poster child for this approach is in melanoma, a serious form of skin cancer. A major phase 2 study combined a personalized mRNA vaccine from Moderna and Merck with the popular checkpoint inhibitor, pembrolizumab. The results were staggering. In patients with high-risk melanoma, the combination therapy reduced the risk of the cancer coming back or death by 49% compared to using the checkpoint inhibitor alone. An even longer follow-up at nearly 3 years showed a 62% reduction in the risk of the cancer spreading to distant organs. These results were so compelling that a massive global phase 3 trial is now underway, aiming to confirm these findings in over 1,000 patients. And it's not just melanoma. Pancreatic cancer is one of the deadliest and most difficult cancers to treat, often called an immunologically cold tumor, because it has very few immune cells inside it, making it resistant to most immunotherapies. Yet, a phase 1 trial of a personalized mRNA vaccine for pancreatic cancer showed that the vaccine could successfully generate a powerful T-cell response. Patients who mounted this response had a significantly longer time before their cancer returned compared to those who didn't. This proves that mRNA vaccines can heat up cold tumors, making the impossible possible. The list goes on. BioNTech, the company behind the Pfizer COVID vaccine, is running a phase 2 trial for high-risk colorectal cancer. Across the world, there are over 120 active clinical trials investigating mRNA vaccines for lung, breast, prostate, and even aggressive brain tumors. Early data from a vaccine called mRNA 4359 being tested in advanced solid tumors shows it can successfully activate the immune system and, in some cases, halt tumor growth. The years 2024 and 2025 are being called pivotal, as breakthrough results are firmly establishing this technology as a transformative force in cancer care. While personalized vaccines are the pinnacle of this technology, they aren't the only strategy. Researchers are also developing off-the-shelf mRNA vaccines. These are not tailored to an individual, but are designed to target those tumor-associated antigens, or TAAs, that are commonly found across many patients with a specific type of cancer. For example, BioNTech's BNT111 vaccine encodes for 4 different antigens commonly found in melanoma patients. In a phase 2 trial, it also showed positive results when combined with a checkpoint inhibitor. These off-the-shelf options have big advantages. They are readily available, meaning a patient doesn't have to wait 6 weeks for a custom dose. They are also much less expensive and complex to produce. This could make them a more accessible first line of defense, or a complementary therapy, potentially available to a much wider population of patients. It gives doctors 2 powerful arms in the mRNA strategy: a hyper-targeted personalized missile and a more general, but still effective, ready-to-fire weapon. The versatility of mRNA doesn't even stop with vaccines. It's being explored to improve other cutting-edge treatments like CAR T-cell therapy. This is where a patient's own T-cells are removed, genetically engineered in a lab to recognize cancer, and then infused back into the body. Currently, this process is slow and uses modified viruses. Researchers are now using mRNA to engineer these T-cells more rapidly and safely, which could make this powerful therapy more efficient and available. And in a fascinating twist, some research published in the journal Nature suggests that even the COVID-19 mRNA vaccines might have had an unintended benefit for some cancer patients. The study indicated that these vaccines can trigger such a broad, general-purpose immune alert that it can increase the median survival time for patients with certain cancers. It's not a direct anti-cancer effect, but it highlights just how powerfully mRNA can stimulate and prime our immune systems. Of course, for all the incredible optimism, there are still significant hurdles to overcome before these vaccines are a standard part of cancer care. The first is cost and complexity. Personalized vaccines are groundbreaking, but with a potential price tag exceeding $100,000 per patient, accessibility will be a major issue. The manufacturing process itself requires immense resources and expertise. Second, cancer is a relentless and adaptable enemy. Tumors can evolve to evade the immune attack, perhaps by stopping the production of the target antigen, effectively taking down their identifying flag. Or they can create a suppressive local environment that chemically tells incoming T-cells to stand down. Finally, there are the technical challenges of delivery and stability, and the complex regulatory landscape that any new class of drug must navigate. However, the unprecedented success and rapid approval of the COVID vaccines have undoubtedly helped pave the way, creating a more streamlined path for their cancer-fighting cousins. The future, however, feels very present. Experts predict that the very first commercial approval of an mRNA cancer vaccine could happen as early as 2029. Healthcare systems are already getting ready. The UK's National Health Service, for example, has established a cancer vaccine launchpad. It's a program designed to fast-track patient enrollment by identifying eligible people from national data and creating a registry for participation in these personalized vaccine trials. What we are witnessing is nothing short of a paradigm shift. We are moving away from an era of treating cancer as an external disease to be poisoned, and into an era of treating it as a malfunction that our own bodies can be taught to correct. It's the culmination of decades of scientific grit and perseverance, a journey accelerated by a global crisis that is now poised to offer profound, new hope to millions. The convergence of genomics, bioinformatics, and mRNA technology isn't just reprogramming immunity, it's reprogramming the future of our fight against cancer.